Hello, I'm Julia Reynolds. I'm the Associate Director for Transformation at the Innovation Agency. I lead the cardiovascular disease and respiratory programs. And the Innovation Agency is the academic health science network for the Northwest Coast. I'm going to talk today about how we built and delivered an improvement programme over the last 5 years to help improve the care and outcomes for people who have atrial fibrillation. Atrial fibrillation is a common arrhythmia, that's heart flutter, found mostly in older people, and it's a major cause of stroke. It's a disease of the aging heart. We work with colleague academic health science networks on this programme, and we delivered our work programme around a detect, protect and perfect framework. That is, find people with atrial fibrillation who are currently undiagnosed, make sure that they are managed well and their therapy is optimised, and make sure that they have the ongoing support and monitoring that they need. In 2016, the Quality and Outcomes Framework, QOF, showed that we needed to find in our region over 24,000 people with AF. These were people with AF who were undiagnosed and didn't know and were unaware they had the condition. And we also looked at people who had the condition on GP registers and found that only 76% of patients were being treated with anticoagulation therapy. Our NHS plan shows an ambition to find 85% of undiagnosed people with AF by 2029 and to make sure that 90% of those that are found are treated with anticoagulation therapy. This number is always increasing due to the ageing population. The approach we took to addressing this issue included improving our engagement with our local clinical networks and healthcare partnerships, and actively collaborating with industry to lever resources into our quality improvement programs. We also look to levering our community assets and our community networks and accelerating progress by ensuring our work linked with local ambitions and activities, and of course using innovative approaches throughout our work and working with a range of innovative colleagues in the health service. In terms of outcomes, on our quality improvement work, we worked with over 136 general practices, over 9 clinical commissioning group areas. And we also worked with 3 clinical commissioning groups who were funded by NHS England to deliver atrial fibrillation virtual clinic sites. And we also levered funding from industry as part of this work through joint working agreements. We engaged 12 community pharmacists to help us define and test a pathway for detecting and monitoring atrial fibrillation. We think this will be very helpful after the COVID crisis recedes to support general practice with managing these patients. We delivered 15 awareness campaigns at community venues with our atrial fibrillation champions and also our own staff. We have a programme of patient-supported insight work which is currently underway to allow us to understand what supports patients need to adhere to therapies and their desire for information. This is particularly relevant at the moment. We developed a set of tools, including quality improvement tools, to support this work. And this includes the Happy Hearts website, which is a website delivered in Cheshire and Merseyside and includes a range of cardiovascular disease resources. So I would invite you to have a look at that website. We also delivered over 500 mobile ECG devices to healthcare teams in primary care and other environments, included the fire and rescue services and other community services like podiatrists, community pharmacists, nurses and care homes. We engaged with anticoagulation services to help develop good communication with GPs and others basically to ensure that the patients were well managed across the pathways. And underpinning this, we had an approach to help reduce health inequalities. We also engaged with services that we don't normally engage with around these issues. So the improvements that we made, and we measured these improvements through the Quality and Outcomes Framework. We found that in 2019, we had only 2,000 people undiagnosed with AF, according to Public Health England estimates. Of course, that number, as I mentioned before, is always increasing. So basically, that indicated that our healthcare system had achieved a 98% detection rate. We still do have variation across the region. And we continue to improve the management of patients. We have demonstrated that we had an 8% increase in anticoagulation therapy, but work is ongoing in this area. So these figures, basically the key figures really taken from QOF, have demonstrated that we can achieve large-scale improvements by working innovatively and collaborating and collaboratively across community, primary and secondary care. Detecting the missing thousands requires us to work across boundaries in an innovative way, and as an integrated health system. Our collaborative approach is underpinned by the engagement and commitment of partners in our region. Thank you very much for listening to this presentation. Please do comment, and we'd be delighted to hear from you, and please do look at our website as well. Thank you.